Hi, this is Dr. Lou Jacobs at Jacobs Chiropractic Acupuncture Center in Portland, Maine, USA. And I have a friend from Maharashtra, India. Her name is Rubina, and she is asking for help with exercises for Symphysis Pubis Dysfunction during pregnancy. She's 7 months pregnant, and she wants to know what kinds of exercises she can do at home that are safe, that could be helpful in reducing the pain in the Symphysis Pubis region. The symphysis pubis is basically your pubic bone, but it's two bones with a piece of cartilage in between. And during pregnancy, if the pelvis becomes misaligned, it can become extremely painful. There are other causes too, but in general, if there's misalignment, it needs to be realigned not only for the best and most easy passage for the baby, but for the most comfort for the mom. So I am going to show some exercises right now that are helpful when you have SPD, or Symphysis Pubis Dysfunction. All right, we're gonna get started on the floor just like this, okay? The idea is to create stability around the pelvis, low back, and core. This in turn creates better position and better movement and better stability within the sacrum, the tailbone, the pelvis, and the symphysis pubis. So here's what we're going to do. We're going to start off with a few exercises that are good for strengthening the core, but that are not so strong that you can't do them during pregnancy. The first exercise we're going to do is called supine core activation, okay? And essentially, all we're doing is we're lying down on our back like this, and we are tightening the muscles of our abs and releasing. Tightening and releasing. Although I may look like I'm early on during a pregnancy, I'm not pregnant. But this, if gently done, is not going to aggravate the baby. It's not going to cause any risk unless you have underlying conditions that you should consult with your doctor about. But in the absence of any issues, this should be very, very safe. You're just, again, just squeezing the abdominal muscles gently and then relaxing them. The next exercise is called heel slides. And for this, you're going to lie on your back again. At 7 months pregnant, Rubina, you may have a more difficult time doing this, but as long as you can be on your back for a short time, you should be okay. So you're going to lie on your back like this, and you're going to lower the leg and raise it, sliding the heel just like this. Up and down on both sides. It's going to feel very gentle, but it will also help to strengthen your core, and it's moving your pelvis, your sacroiliac joints, and your pubic symphysis all at the same time. Movement will help to shift things, hopefully, into a slightly better position. And also tone the ligaments and tendons in and around the front of the pelvis, and that may help as well. Pelvic tilt is the next exercise that's going to be helpful. You're going to lie on your back again, just like this, and you're going to tilt the pelvis back and down. Back and down, sort of rolling back and then rolling down, rolling back and rolling down, just like that. And you can repeat all of these 10 times, 12 times, and then do it again, and then do it again. So 3 sets of 10 to 12 repetitions for each of these exercises. Or you can choose a couple of these exercises and leave the others for later. The next exercise is called cat-camel. You're going to be in this position on your hands and knees, and you're going to raise up, and then raise lower down. Raise up, and lower down. Raise up, and lower down. Just like that. This is activating the low back. It's activating the core, and it's tilting the pelvis in just the right ways. If it's uncomfortable, in fact, if any of these are uncomfortable, then stop doing them. You shouldn't do any of these if they cause any kind of discomfort, pain, or cramping. The next exercise that can be done on the floor is called a fire hydrant. And basically, you're going to be on all fours like this, and you're going to raise one leg up like this and down, up and down. From the front, up and down, up and down. Keeping your arms here at shoulder width apart, stable, and then lifting the leg out, just like that. Like you're a dog going to the bathroom on a fire hydrant. The next exercise is called clamshells, where you're going to be on your side like this, your legs together, and you open your legs like this, like a clam. Now this is more for the back of the hip and the gluteal muscles back here than it is for the front, but anything that strengthens and stabilizes the core, the hips, the glutes, and all these muscles around the pelvis, they're all going to be potentially helpful. And again, we want to encourage movement in the pelvis. Clamshells definitely do that. When they start to make you sore, take a little break, repeat on the other side, and then keep doing them. Again, 2 to 3 sets of 10 to 12 repetitions if you can. If not, you do less. You do as much as you can, but not to the point that it causes any real discomfort. There's a few exercises that we can do seated. So let me show you how those work. One of my favorites for SPD is squeezing the knees together in a seated position. You can use your hand, you can use a tennis ball, you can use any kind of ball or anything that's soft, but I'm going to use my hand. You sit in a chair and you squeeze the knees together, just like this. This is called seated hip adduction. Just like this. Hand or tennis ball or basketball or kickball between the knees, and squeeze gently and release. Squeeze and release. Squeeze and release. You might actually feel this a little bit in that symphysis pubis area, and that's okay as long as it doesn't cause real heavy pain. You might even hear a little clicking coming from the back of your pelvis, maybe even from the symphysis pubis. It's not unusual. It's also not terribly common. But either way, it's not necessarily a bad thing, and it shouldn't cause you any additional discomfort. If it would, you'd want to speak to your doctor. The next exercise is called an almost Kegel, or even a Kegel exercise, where you are squeezing the muscles of the pelvic floor as if you're trying not to go to the bathroom. You're trying to hold it in, okay, to prevent yourself from urinating or defecating. So you will squeeze and sort of lift the muscles on the pelvic floor as if you're holding something in. And squeeze and breathe and release. Squeeze, breathe and release. And you can do as many as 10 to 12 repetitions and 3 sets of these as well. This is also helpful for that area down in the base of the pelvis for stabilizing it and for creating the tension that is needed to hopefully help create an environment that is less inflamed, less painful, and less likely to move in ways that it's not supposed to move. There's a couple others that are done while standing that I'd like to show you real quick, okay? Okay, and these are going to be as follows. The first one, okay, is going to involve you standing and holding your arms out in front like this and just gently kicking the leg out to the side like this, sliding it along the floor and coming back up. Now you want to make sure that with the baby up here, you're not unstable and you don't fall. So be very careful while doing that. If you need to hold on to something, you could hold on to something and do it as well. The next exercise is a wall squat, where you go to the wall like this, put your hands against it, come down into a squat and come back up. Down into a squat and come back up. You're using the wall to stabilize you, prevent you from falling, and just to give you a little extra hand if you need it, coming back up. Okay, these are great exercises for SPD. They're really, really helpful. And I suspect that if you do them, Rubina, or anyone else who's suffering from SPD, that you will get a little bit of relief. Hopefully it will be enough to carry you through the rest of the pregnancy in the absence of a chiropractor who can help you. Ultimately, for this type of issue, chiropractic is really, really helpful, but you need someone who knows what they're doing. You need someone who is trained to deal with pregnant women and will be as safe as possible with you. Those are great solutions too if you have someone in your area. I'm not sure where you are in your state and whether or not you are close to Mumbai or not, but there may be someone there if you are close. And if not, you can try this on your own at home. Thanks so much for watching, and thanks so much for your questions. And I really hope that these videos help. I hope everything is really great where you are in India and nice and warm. I'm going to walk outside here and show you what it's like right now. You picked a wonderful day to ask me questions because I had plenty of time today to make this video because of what's happening outside. It's freezing cold, and as you can see, there is snow everywhere. Look at that. Freezing cold, lots of snow. A great day to make videos for you. Thanks so much for watching our YouTube channel. I really appreciate it. Share this with your friends and take care. We'll talk soon. Bye-bye.